Good morning, all dear my students. Today, I'll be talking about indirect pulp therapy, which is a part of pulp therapy procedures. There are different terminologies which is related to pulp therapy. The treatment aspects, mainly indirect pulp capping, direct pulp capping, pulpotomy, pulpectomy, apexification, apexogenesis, and so on. So today we'll be mainly concentrating about indirect pulp therapy. So what do you understand from the name indirect pulp therapy? There is a pulp therapy done, but which is indirect to the pulp. That is, which is not directly in contact with the pulp. So according to the definition, the indirect pulp therapy is a procedure which is involving a tooth with deep carious lesion where the carious dentin removal is left incomplete, and then the decay process is treated with a biocompatible material for some time in order to avoid the pulpal tissue exposure. So this is actually meaning to say that whenever there is a deep carious lesion, instead of excavating the caries more and exposing the pulp, that we suppose that there will be exposure of the pulp if we go beyond, or if we go excavating it more. So in such cases, we stop at the lowest level where the decay process is removed and the soft remaining decay process is treated with a biocompatible material, which is the affected dentin. So there is always dentin which is categorized into two, which is infected and affected dentin. We are removing the infected part of the dentin and maintaining the affected part, which will be treated with the material so as that affected material or affected dentin will be remineralized, forming the tertiary dentin formation or secondary dentin formation will be there. Okay, so this is a process where we are, instead of exposing the pulp, we are trying to treat the dentin process and avoid the pulpal tissue exposure. Now, what are the indications when we are supposed to do this indirect pulp capping? That is, deep caries where complete removal of the caries can cause pulpal exposure. As you can see in the picture here, the decay which is in close proximity to the pulpal tissue is shown here. So when this is the case, we are excavating the caries and then removing all the infected dentin and retaining the affected dentin part, which is then again filled with some composite material or any pulp capping material such as calcium hydroxide or NTA or biodegradable. There are so many materials available nowadays. So with those materials, we are trying to, which we can use for the purpose. Those materials we can use for the purpose of this indirect pulp capping. And after the capping, we can do a composite filling or any other filling materials can be used to close the cavity. So this is the ideal and most important indication for the indirect pulp capping procedure. Now let's see the contraindications where we are not supposed to do this. In summary, what I can say is like any kind of inflammatory reaction or any kind of pathogenesis which is related to that tooth, we are not supposed to do any indirect pulp capping procedure. Sharp penetrating pain that persists after withdrawing the stimulus, prolonged spontaneous pain, particularly at night, excessive tooth mobility, purulence, tooth discoloration, all these things are showing off or indicating that the pathology is there. So any kind of pathology which is related to this tooth, we are not supposed to do indirect pulp capping. So every pathologist you can include in the contraindication part. Next is advantages. What is the advantage of doing an indirect pulp capping than treating it directly with the pulp? It sterilizes the residual caries and its remineralization is induced, decreases in hyperemia, pulp vitality will be maintained, continued root and closure also we can achieve. Simple procedure, this is a simple procedure whereby we can avoid the complicated procedures like RCT and all, and especially it is recommended for rampant caries to halt the fast spreading kind of caries in the rampant caries, and immediate patient comfort can be provided. So these all are the advantages of the indirect pulp therapy. Moving on to the procedure, as you can see in this picture, there is a deep caries which is involving in a molar tooth, and this is a radiograph which is showing the deep caries lesion. Isolation with rubber dam can be done, which is followed by removal of the carious dentin, that is infected dentin is removed, which is totally demineralized, and unremineralizable, which is superficially placed and which has no sensation. This type of infected dentin is removed completely. In the second hand picture, you can see the dentin, infected dentin part is completely removed and clean. This is the difference between infected and affected dentin. Okay, infected is the outer surface, outer infected dentin, which is a superficial layer which is confirmed of bacterial invasion, unremineralizable, which is a dead tissue without sensation and which is not useful to us. And inner affected dentin is there, which is having fewer bacteria, which is remineralizable, which is vital and sensitive, which is very useful to us. So we are trying to remove this outer infected dentin and retain this inner affected dentin part. Then a layer of calcium hydroxide is applied over to the affected dentin area, as you can see in the picture. Then interim restoration, IRM restoration is given. After 6 to 8 weeks, a permanent restoration can be given in indirect pulp capping treatments. There is two concepts which says that in the first setting itself, we can complete the whole procedure. Our second school of thought is that in 2 appointments, we should complete this indirect pulp capping procedure. First appointment, we have to remove the caries and then treat it with the temporary filling. And then after 6 to 8 weeks, again, we have to go to the cavity, clean it, leave a deepermost layer of the calcium hydroxide, and then which is the tertiary dentin formed, which should be undisturbed, and then we have to go with the permanent restoration. So that's all about the indirect pulp capping procedure.